Sue, thank you very much. Thanks for getting us started, and I know we want to get to our the folks who will come to this podium, but I do want to express gratitude for everyone taking the time to be here. I've described this bill in very blunt terms. The bill, the legislation, which has been developed in the Republican caucus in the U.S. Senate, is, in my judgment, a snake in the grass. I wish it were only a snake that could bite you but not cause harm, but I think it's a venomous snake that will cause great harm to people. At least will cause them great harm because they will lose their health coverage. But of course, you can imagine what happens after that for a lot of people. I'll leave that to others to analyze and speculate what happens after you lose your coverage. But I think a lot of people in this room understand what happens. So the unfortunate thing is that it is a snake in the grass because it will bite people who will be unsuspecting, won't even know that that threat is closing in on them before they actually get bitten.
Hi, good morning. My name is Ashley Murosky, and since the first day my battle began, I've undergone countless procedures, MRIs, CT scans, PET scans, appointments, and blood draws. I've had multiple surgeries, emergency hospital visits, and ambulance rides. If that wasn't enough to manage, I'm now forced to be consumed with the fear of what could happen to me if something like the Graham Cassidy bill becomes a law.
Good morning. I'm Jody Lemex, and this is my son Joshua. I want our lawmakers to know that if Graham Cassidy passes and these safeguards disappear, they will be putting my son's life and the sons of so many other children, 40,000 babies a year born with this heart disease, they will be putting their lives in jeopardy. As Jimmy Kimmel pointed out, most Americans aren't as lucky. To watch your baby have open heart surgery is devastating. It can almost shatter you. But it would be even more unbearable if you couldn't afford to give your child the treatment and the care that he or she needs to live. We desperately need the protections in the Affordable Care Act. Please don't take them away.
Our champions and the press, as long as we have to and as many times as we have to.